welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. According to the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. The concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Every adult should know which conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. We're joined by Dr. Gaurav M. Ganeshwala, consultant interventional cardiologist, Ruby Hall Clinic, Pune. Dr. Arun Kaushik P., a consultant interventional cardiologist, managing director, Shadow Heart Foundation, Coimbatore, and Dr. Karunakar Rapolu, a consultant cardiologist, Apollo Hospitals, Hyderabad. Thank you so much, doctors, for joining us and helping us create awareness about cardiac issues as well as CPR. Dr. Kaushik, first to you, people 30, 40 years of age are having heart attacks and serious heart problems. What is the main cause of a steep increase in heart problems among those who are younger?
Yes, we do see a big surge in heart problems in the young, maybe even marriage, starting the second decade. So the poor lifestyle is the main predominant cause of this big surge in the last 2 decades. So poor lifestyle means a lack of regular physical activity and more job stresses and poor sleep pattern, increased screen time and very bad diet, less home cooking. So that leads to more saturated fat, more trans fat, less fiber, and increasing incidence of alcohol, incidence of smoking. So this poor lifestyle leads to an increase in the incidence of diabetes, hypertension, dyslipidemia, that is increased cholesterol levels, and mental health problems and obesity. These all subsequently leads to very increased incidence level of heart disease in the very young population, the epidemic level. So what I'm trying to say is the poor lifestyle is the ultimate cause of all surges happening mainly in the young population.
All right, we'll move on to the next question. And Dr. Rapolu, there's a lot of misinformation about self-care that can be done during a heart attack. Can a person really help himself or herself during a heart attack? And if yes, how?
Yeah, okay. Heart attack is an emergency. So during the heart attack, a person can alert the family and friends and co-workers and ask them to take them to the nearby cardiac center. Or if patient is alone, he can contact the emergency number like 108 and alert them to come for his rescue. And the best self-care during the heart attack is to keep calm and alert the people around and ask them to take the nearby hospital. Here, the time is the muzzle. So if you reach early, their doctors will treat the heart attack and try to rescue the heart muscle as much as possible. Then, while preparing to go to the hospital, if people are not allergic to the aspirin, they can take 325 mg of chewable aspirin, that is Disprin, most commonly available in India as Disprin. So that helps in increasing the blood flow and to the heart. And while waiting for the help to come, patient can stay calm and preferably can stay on the floor. And if any signs of impending unconsciousness or dizziness, there sometimes coughing during the episode can help to prevent certain arrhythmias and maintain the BP. And here a word of caution, certain drugs like nitrates should be avoided during the heart attack because certain types of heart attacks can, these nitrates, especially the sorbitrate most commonly available form, that can lead to hypotension in certain heart attacks. So, better not to take nitrates and take the aspirin 325 mg chewable form and alert the people around you to take you to the nearby hospital. That is the best self-care during the acute heart attack.
All right. Dr. Ganeshwala, if you could tell us, can heart problems also cause pain in the legs?
So it's a fact. All of us think about chest pain when we are concerned about heart related problems. But this is again a very important symptom of heart related disease, or rather cardiovascular disease. So many a times people who have pain in their legs while walking, we call it claudication. So that is one of the symptom of reduced blood flow to the muscles of the legs. Now this reduction of blood flow to the muscles of the legs can be because of heart failure, where the pumping capacity of heart has significantly gone down. Another possibility is there is a blockage in the any of the artery which is supplying the legs. Now remember, if anybody is developing blockage in the artery supplying in the legs, there is a very strong possibility that they can also have blockage in the heart and brain arteries. Almost 50% of individuals with leg artery blockage can also have heart related blockage or blockage in the brain. So that is a very common combination, and you have to be very careful if you have claudication or pain while walking. That is a very important symptom. Many a times patients who have weak heart with lower pumping capacity, or people who have rhythm related problems like atrial fibrillation, when the rhythm is irregular and fast, sometimes they can throw thrombus or blood clot from the heart to the leg arteries, and that can also suddenly block the leg arteries and patient can develop severe pain in legs. So these are all common possibilities where patient may not have classical chest pain, but it can be an indirect marker of heart related disorders. So this is called peripheral arterial disease, and peripheral arterial disease is a very common complication along with coronary artery disease, that is blockage in the heart.
Right, Dr. Kaushik, many people get confused about heart attack, cardiac arrest and heart failure. So can you please explain their differences?
Okay. So we have three terms. Heart attack, cardiac arrest, heart failure. See, heart attack is the acute blockage of one of the vessels that supplies the heart. So which ends up patient developing chest discomfort. So the complications of the heart attack depends on the area of the quantity of the territory involved by the blockages. So this is called as heart attack. So it's an acute condition. So patient will be conscious. They will have some time. So they will be complaining of chest discomfort, and then it is an emergency condition that warrants an immediate admission to the emergency room close to the patient. So coming to the second term, that is called as cardiac arrest. So cardiac arrest is it's a very dramatic catastrophe leading on to stoppage of effective pumping of the heart. So which leads to unconsciousness. So which we would have witnessed sudden patient falling unconscious in the public. So this is an acute stoppage of heart. So once heart stops, blood flow to the entire body stops. So it's like a total power shutdown. So the most common cause of cardiac arrest is also heart attack. But there are other causes that can also ends up in cardiac arrest. So cardiac arrest is the final endpoint of all worst situations that can happen in the body. So that is called as cardiac arrest. So this is the reason which we will be having the government and non-governmental agencies are installing AED, that is the public defibrillator everywhere. And we also train the public for basic life support. So BLS, that CPR you had mentioned, no? So these are all mainly to make him revive out of the danger arrest and make him to some extent conscious and get an help and an ambulance, then subsequently getting inside the emergency room. So there is a difference between heart attack and cardiac arrest. Lastly, the heart failure. See, heart failure, it could be acute, dramatic or a chronic process. We may see in the outpatient, we may see in the emergency, or sometimes when we give a fitness for surgery. So that is a loss of contractility of a part of the muscle. Heart is a muscle, and either a part of the muscle is not functioning effectively. So that is called as heart failure. So this mostly leads to symptoms like breathing difficulty, so which patient may not think that it is related to the heart. So this heart failure leads to many hospitalizations, so loss of quality of life, even there is a risk of sudden cardiac death, and it has to be evaluated again depending upon what is the cause of heart failure. Again, heart attack is the most common cause of heart failure in our part of country, in India, but there are other causes that can also cause heart failure. So we need to be very clear on these three terms, that is cardiac arrest, heart attack, and heart failure.
All right, Dr. Ganeshwala, if now we've learned the differences between different heart attacks and heart failure, etc. So what is the ABC for CPR? Do we need to check the airway first and then perform CPR?
So CPR is basically cardiopulmonary resuscitation. So there are three important steps in cardiopulmonary resuscitation. That is A stands for airway, B stands for breathing, and C for circulation. So whenever we found any patient who is unresponsive or unconscious, is not breathing spontaneously, and we are not getting the pulse, that means that patient has a cardiac arrest. And this is the patient who is a candidate for cardiopulmonary resuscitation. So once a patient has cardiac arrest, we should immediately alert the emergency team. So call 100 or 102 and alert the emergency medical services. And our focus after that should be on that particular patient. So make sure that his airway is patent. For that, we extend his neck, we keep his chin towards upper side. That means the airway remains patent for a long time without any obstruction. Then we start chest compressions. For chest compressions, we use both our palms locked in together, and then we give effective compressions in the center of the chest wall. So effective compressions means we are supposed to give chest compressions at a rate of 100 to 120 per minute, and the depth of compression should be around 4 to 5 centimeters. That means around 2 inch with each cycle. And in between, the chest should be allowed to expand. And along with this chest compressions, it is very important that we give mouth-to-mouth breathing to that particular person. For that, we need to give 2 breaths every 30 seconds. Make sure that when we are giving breath, the airway is open and his chest expands. Now, another important question is how long we should continue the CPR. So remember, till the time we get the emergency medical services available, you have to continue the cardiopulmonary resuscitation.
All right, Dr. Rapolu, we've learnt about CPR. If you could tell us, what are the current guidelines for CPR in India?
Current guidelines of CPR are formulated by Indian Resuscitation Council. So latest updated in 2017. They came up with 3 basic guidelines. The first one is the compression only life support. That is only chest compression. This is for the layman, whoever not trained in the medical terms, they can do this. And the second one is basic cardiopulmonary life support. That is for medicos and paramedical persons who are trained in cardiopulmonary resuscitation. Outside the hospital, if the event occurs outside the hospital, they can go for a BCLS pathway. Whereas in the third one is comprehensive cardiopulmonary life support. That is for in-hospital cardiac arrest. So these are the 3 basic guidelines. I would like to emphasize, as Dr. Ganesh explained, here the majority of the times events occur in the society. So lay people can start COLS, compression only life support. That is, whenever we see a unresponsive person without any pulse or breathing, we should alert the system and we can call the help and emergency numbers. Then immediately we can start the CPR by compressing in the chest. So one of our palm should go into the middle of the chest. Then the next hand should go like this with interlocking fingers. Then we start compressing without bending the elbows here. Without bending, you should give the compressions, effective compressions of 100 to 120 per minute with 2 breaths for every 30 seconds. But that is the BLS. For in cardiac compression only life support, without any breathing, you have to give continuous chest compressions without stopping till the help arrives. So that is the compression only life support. Basic life support in that if you have automated external defibrillator, you can take the help of automated external defibrillator, and if it prompts to give a shock, we can give a shock. That's how these are the current guidelines of CPR in India.
All right, on that note, we'll slip into a short break and return with more questions for the doctors. Do stay with us. Welcome back. You're watching Health and Wellness. We're talking about heart health and what you can do if someone is undergoing a heart attack. Now, Dr. Kaushik, what are the after effects of a cardiac arrest? What precautions does a person need to take after they're discharged?
See, the after effects of cardiac arrest depends on the time we resuscitate, how early it is, and also the cause of the cardiac arrest. So we need to understand the body has gone from a point of no blood supply, complete shutdown to complete recovery. So the spectrum of recovery ranges from complete normality, a very positive note, to even a persistent vegetative state, meaning just being unconscious but alive. So vegetative state. So it could be from this spectrum to that spectrum. So after discharge, coming to after discharge, the risk of another cardiac arrest still remains, although it can be very well prevented by treating the cause of the cardiac arrest and certain medications and certain devices like ICD, CR. So there are certain devices too. So there are multiple modalities to prevent further cardiac arrest. But we should know one should be very consistent in following his cardiac, and his efforts has to be very, very consistent in preventing further cardiac arrest after discharge.
Right. Dr. Ganeshwala, there's always a fear that if a person, giving CPR is not well trained, he may cause serious damage to the patient. Does India have a clear law on this, and what is the liability of a rescuer when attempting resuscitation?
So this is again a very important question, because many a times we have a fear in our mind when we see somebody who has a cardiac arrest, whether to go for the help of that particular individual. But remember, if a person is unresponsive, he is not breathing, he has a cardiac arrest, and if we initiate cardiopulmonary resuscitation with chest compression, and in doing so, if a patient has rib fracture or if we break his ribs, they cannot sue you. So there is no law which clearly states that you will be sued if there is a fracture or any damage to the body part of that particular patient during cardiopulmonary resuscitation. So you should be fearless, because life is more important than breaking a rib. Most of the times it requires only supportive management. You don't even require any surgery for that rib fracture.
All right, Dr. Rapolu, how does an automatic external defibrillator help a person who is in cardiac arrest?
During the sudden cardiac arrest, the most common cause for sudden cardiac arrest is dangerous rhythms like sustained ventricular fibrillation and pulseless ventricular tachycardia. So these rhythms, whenever we attach the patient to automated external defibrillator, the machine analyzes the rhythm, and whenever these rhythms are identified by automated external defibrillator, it tells us to deliver a shock. So once we deliver a shock, that rhythm resets into a normal sinus rhythm, and patient becomes responsive by restoring a natural heart beating. So that's how automated external defibrillators are useful during the resuscitation process, and they analyze the rhythm and they tells us when to give the shock to a shockable rhythm is causing the sudden cardiac arrest. So that's how automated external defibrillators are useful, and we have to promote them at the community level. We have to give the training how to use them at community level.
All right, Dr. Kaushik, people survive a first heart attack but are at increased risk for another one. So what precautions should they do to reduce the chance of a second heart attack?
See, having already had an heart attack and trying to prevent the second heart attack, that is what we call a secondary prevention. So the responsibility of both the doctor and the patient has become high. So what exactly has to be done is the same precautions what we do in terms of primary prevention. That is prevention on the first heart attack, along with the regular consultation with the cardiologist, involving the cardiac rehabilitation team. The cardiac rehabilitation team includes cardiac physiotherapists, cardiac dietitians, health coaches sometimes. So and many more guidances on top of what we've been doing regularly and on top of medications. So it becomes a holistic approach, both in terms of medication and lifestyle changes. So that will make the secondary prevention, that is preventing the second heart attack, realistic.
All right, thank you so much, doctors, for joining us on the program and speaking about the issues around heart health and how people can help those undergoing a cardiac arrest. And thank you all for watching at home. Goodbye.